Question 1. A patient presents with a deep laceration on the left forearm due to a fall while hiking. After cleaning and examining the wound, the physician performs a simple repair. Which CPT modifier would be appropriate if an E/M service was also performed and was significant and separately identifiable from the procedure? A. -51. B. -25. C. -59. D. -76. Answer: B. -25. This question tests your knowledge of CPT modifiers, specifically Modifier 25, which is crucial for distinguishing separate services. Modifier 25 indicates that a significant, separately identifiable evaluation and management (E/M) service was performed on the same day as a minor surgical procedure. The keyword significant and separately identifiable is the key clue, meaning the E/M service went beyond the typical pre-procedure work. For example, if a patient comes in for a rash and during that visit, the physician also decides to remove a wart, the rash E/M would likely be separately billable with Modifier 25. Always remember to use Modifier 25 when the E/M service stands out as a distinct and medically necessary part of the visit. Question 2. A patient is diagnosed with essential hypertension. How would you locate the correct code in the ICD-10-CM alphabetic index? A. Hypertension, secondary. B. Essential, hypertension. C. Hypertension, essential. D. Blood pressure, high. Answer: C. Hypertension, essential. This question focuses on the fundamental skill of navigating the ICD-10-CM alphabetic index, specifically finding the correct main term. The main term in a diagnostic statement is typically the condition, disease, or symptom, and hypertension is the primary condition here. You should always start by looking up the main term, then locate any modifying terms like essential indented underneath. For instance, you wouldn't start with essential or secondary because these are descriptive terms, not the core condition itself. To find the correct code, always start with the main disease, injury, or symptom, like diabetes, fracture, or fever, before searching for specific types. Question 3. What does the medical prefix Brady- mean? A. Fast. B. Slow. C. Painful. D. Difficult. Answer: B. Slow. This question tests your understanding of common medical prefixes, which are essential building blocks of medical terminology. The prefix Brady- consistently indicates slowness, as seen in terms like bradycardia, meaning a slow heart rate. Understanding these prefixes allows you to decipher complex medical terms, even if you haven't encountered them before. For instance, knowing Brady- means slow helps you understand that a patient with bradykinesia has slow movement. Learning common prefixes, suffixes, and root words is a foundational step in mastering medical terminology. Question 4. A 68-year-old patient undergoes an initial comprehensive preventive medicine evaluation. Which CPT code category would typically be used for this service? A. Surgery. B. Radiology. C. Evaluation and management, E/M. D. Medicine. Answer: C. Evaluation and management, E/M. This question assesses your knowledge of CPT code categories, particularly for preventive services. An initial comprehensive preventive medicine evaluation describes a type of patient encounter focused on health maintenance and risk assessment, which falls squarely within the evaluation and management, E/M, section of CPT. E/M codes are used for office visits, hospital visits, consultations, and other services where a physician evaluates and manages a patient's health. For example, a routine physical exam for a healthy individual would be coded from the preventive medicine subsection of E/M. Remember that E/M codes cover the cognitive work of the physician in assessing and planning patient care. Question 5. Which of the following is considered a covered entity under HIPAA? A. A patient's family member. B. A health plan. C. An employer. D. A medical device manufacturer. Answer B. A health plan. This question assesses your understanding of the Health Insurance Portability and Accountability Act, HIPAA, and which entities it directly regulates. HIPAA defines covered entities as health plans, healthcare clearinghouses, and healthcare providers who transmit health information electronically in connection with transactions for which the Secretary of HHS has adopted standards. Health plans are explicitly listed among these entities because they deal directly with protected health information. For instance, an insurance company processing claims is a health plan and must comply with HIPAA regulations regarding patient data privacy. Understanding who is a covered entity is crucial for knowing who must protect patient information under federal law. Question 6. A patient is diagnosed with a fracture of the shaft of the right tibia, initial encounter for closed fracture. In ICD-10-CM, which character is used as a placeholder when a code has fewer than 6 characters and requires a 7th character? A. 0. B. X. C. 9. D. Z. Answer B. X. This question tests your knowledge of the ICD-10-CM coding structure, specifically the use of the placeholder character. The placeholder character X is used when a code has fewer than 6 characters and needs to be expanded to accommodate a required 7th character. This ensures that the 7th character, which often specifies the encounter type, e.g., initial, subsequent, sequela, is in the correct position. For example, a code like S82.201_ would use an X to fill the 5th character position if no specific detail is provided, allowing the 7th character, e.g., A for initial encounter, to be correctly placed, such as S82.201XA. Always remember to use X as the placeholder to maintain the integrity of the code structure when a 7th character is necessary. Question 7. A physician documents that a patient has bilateral cataracts. Which ICD-10-CM guideline applies to coding laterality for this condition? A. Code only the more severe side. B. Use an unspecified code if laterality is not specified. C. Code for each side separately if specific codes exist for left and right. D. Use a single code for bilateral if available. Answer D. Use a single code for bilateral if available. This question tests your understanding of laterality guidelines in ICD-10-CM, which dictate how to code conditions affecting one or both sides of the body. When a condition is documented as bilateral and the ICD-10-CM code set provides a specific code for bilateral involvement, that single bilateral code should be used. The guideline prevents overcoding or undercoding by providing a single, precise code for conditions affecting both sides simultaneously. For example, if a code exists for bilateral carpal tunnel syndrome, you would use that one code rather than separate codes for left and right. Always look for a specific bilateral code first when dealing with conditions affecting both sides. Question 8. What is the appropriate HCPCS Level II code for a durable medical equipment, DME, item, such as a standard wheelchair? A. A code from the CPT codebook. B. A code beginning with J. C. A code beginning with E. D. An ICD-10-CM code. Answer, C. A code beginning with E. This question assesses your understanding of HCPCS Level II codes, specifically for durable medical equipment, DME. HCPCS Level II codes are used to report services, supplies, drugs, and equipment not covered by CPT codes, and codes starting with E are specifically designated for DME. A standard wheelchair, being a piece of durable medical equipment, would fall into this category. For instance, Code 1161 represents a manual adult-size wheelchair, includes tilt-in-space feature, fixed or adjustable car. This is an example. Actual code may vary, but the prefix is consistent. Knowing the HCPCS Level II code structure helps you quickly identify the correct category for items like wheelchairs, crutches, or hospital beds. Question 9. In the context of medical billing, what does medical necessity primarily refer to? A. The patient's ability to pay for services. B. The documentation of the patient's preferences for treatment. C. The justification that a service or treatment is reasonable and essential for the diagnosis or treatment of illness or injury. D. The hospital's ability to provide the service. Answer, C. The justification that a service or treatment is reasonable and essential for the diagnosis or treatment of illness or injury. This question focuses on the critical concept of medical necessity in medical billing, which is fundamental to appropriate reimbursement. Medical necessity means that the healthcare service or treatment provided is reasonable, necessary, and appropriate for the patient's condition, based on clinical standards of care. It's not about what the patient wants or what the facility can offer, but rather what is clinically justified. For example, an MRI for a persistent headache might be medically necessary if other evaluations have failed, but a routine screening MRI without symptoms typically would not be. Always ensure documentation supports medical necessity, as payers will deny claims lacking this crucial justification. Question 10. A patient experiences a severe allergic reaction to a new medication. Which section of ICD-10-CM would you consult to find an external cause code for this event? A. Chapter 1, Certain Infectious and Parasitic Diseases. B. Chapter 19, Injury, Poisoning and Certain Other Consequences of External Causes. C. Chapter 20, External Causes of Morbidity. D. Chapter 21, Factors Influencing Health Status and Contact with Health Services. Answer, C. Chapter 20, External Causes of Morbidity. This question tests your knowledge of the ICD-10-CM codebook structure, specifically where to find codes describing the circumstances of an injury or adverse event. Chapter 20, External Causes of Morbidity, is dedicated to codes that identify how an injury or health condition happened, not the injury itself. An allergic reaction to medication is an adverse effect caused by an external substance, making this chapter the correct place to find codes describing the cause. For example, codes for falls, motor vehicle accidents, or adverse effects of drugs are found in this chapter. Remember that external cause codes are supplemental and are always reported in addition to codes describing the condition itself. Question 11. What is the main purpose of an Advance Beneficiary Notice, ABN? A. To inform the patient of their right to appeal a denial. B. To notify the patient that Medicare may not pay for a service and the patient will be responsible for payment. C. To get the patient's consent for a surgical procedure. D. To inform the patient of their HIPAA privacy rights. Answer, B. To notify the patient that Medicare may not pay for a service and the patient will be responsible for payment. This question focuses on the critical billing document known as an Advance Beneficiary Notice, ABN, which is primarily used with Medicare patients. An ABN is a written notice given to Medicare beneficiaries before services are furnished when the provider believes Medicare probably or certainly will not pay for some or all of the services. It ensures the patient understands their financial responsibility if Medicare denies coverage. For example, if a patient requests a cosmetic procedure not covered by Medicare, an ABN would be issued to ensure they know they are financially liable. Always remember that the ABN protects the provider's right to bill the patient and the patient's right to make an informed decision. Question 12. A CPT code for a surgical procedure often includes the typical preoperative care, the operation itself, and routine postoperative care for a specific period. What is this bundled service referred to as? A. Unlisted procedure. B. Global surgical package. C. Episode of care. D. Comprehensive service. Answer B. Global surgical package. This question tests your understanding of the global surgical package, a key concept in CPT coding and billing. The global surgical package describes a bundled service that includes not just the surgery itself, but also typical preoperative care, the procedure, and routine postoperative care within a defined time frame. This bundling prevents separate billing for routine services commonly associated with a surgery. For example, for a common surgery, the global period might include the visit the day before surgery, the surgery, and follow-up visits for 90 days afterward. Understanding the global package is essential to avoid unbundling and ensure accurate billing for surgical services. Question 13. Which of the following suffixes means surgical removal? A. Ostomy. B. Ectomy. C. Otomy. D. Plasty. Answer B. Ectomy. This question tests your knowledge of common medical suffixes, which are crucial for deciphering surgical procedures. The suffix ectomy consistently indicates the surgical removal of an organ or part of the body, as seen in terms like appendectomy, surgical removal of the appendix. Knowing this suffix helps you understand the nature of a procedure described in medical documentation. For example, if a patient has a tonsillectomy, you know their tonsils were surgically removed. Mastering these suffixes helps you interpret surgical reports and accurately assign procedure codes. Question 14. What anatomical term means away from the midline of the body? A. Medial. B. Lateral. C. Proximal. D. Distal. Answer B. Lateral. This question tests your understanding of fundamental anatomical directional terms, which are essential for precise documentation and coding. Lateral specifically means away from the midline of the body or toward the side. This is contrasted with medial, which means toward the midline. For instance, the ears are lateral to the nose, and the little finger is lateral to the thumb when the hand is in anatomical position. Knowing these terms allows you to accurately interpret descriptions of injuries or conditions and their locations. Question 15. A patient undergoes an arthroscopy of the right knee and a separate, distinct arthroscopy of the right shoulder during the same operative session. Which CPT modifier would be most appropriate for the second arthroscopy procedure code? A. -51. B. -25. C. -59. D. -78. Answer C. -59. This question tests your knowledge of CPT modifier 59, which is crucial for identifying distinct procedural services. Modifier 59 indicates that a procedure or service was distinct or independent from other services performed on the same day. This modifier is often used when procedures are performed on different anatomic sites during the same session, as in the example of the right knee and right shoulder arthroscopies. Using Modifier 59 correctly prevents unbundling and accurately reflects that two separate, distinct procedures were performed. Remember, Modifier 59 specifies that two procedures are distinct due to different sites, different encounters, or different procedures. Question 16. What is the primary coding system used to report physician services to third-party payers? A. ICD-10-CM. B. CPT. C. HCPCS Level II. D. DRG. Answer B. CPT. This question asks about the primary coding system for physician services, which is foundational to outpatient and professional coding. The current procedural terminology, CPT, codebook is the standard used to report medical, surgical, and diagnostic procedures and services performed by physicians and other healthcare providers. While ICD-10-CM codes diseases and HCPCS Level II codes supplies and non-physician services, CPT is specifically designed for physician procedures. For example, an office visit, a surgical procedure, or a laboratory test performed by a physician would all be reported using CPT codes. Think of CPT as describing what the physician did. Question 17. A patient is seen for follow-up care for a diabetic foot ulcer that is improving. The physician notes the patient is stable and performing wound care at home. Which type of ICD-10-CM seventh character would typically be used for this follow-up encounter? A. Initial encounter. B. D. Subsequent encounter. C. S. Sequela. D. P. Progressive. Answer B. D. Subsequent encounter. This question tests your understanding of ICD-10-CM seventh characters, which provide crucial information about the episode of care for injuries and certain other conditions. A subsequent encounter, D, is used for encounters after the active treatment of the injury or condition has concluded, such as during the healing phase or for routine follow-up. The keywords follow-up care and improving clearly indicate that the initial active treatment is complete, making D the appropriate choice. For instance, once a fracture is set and the patient is in a cast, follow-up visits would typically use a D seventh character. Always choose the seventh character that accurately reflects the patient's current phase of treatment. Question 18. A physician dictates patient with chronic obstructive pulmonary disease, COD, exacerbation. Which body system is primarily affected by COPD? A. Cardiovascular system. B. Digestive system. C. Respiratory system. D. Nervous system. Answer C. Respiratory system. This question assesses your basic knowledge of human anatomy and major body systems, specifically related to common conditions. Chronic obstructive pulmonary disease, COD, is a progressive lung disease that primarily affects the respiratory system, impacting the airways and air sacs in the lungs. Understanding which organ system is involved in a diagnosis helps in locating relevant codes and understanding the patient's condition. For instance, symptoms like shortness of breath and coughing are clear indicators of respiratory system involvement. Linking diseases to their primary body system helps you navigate medical records and coding guidelines more effectively. Question 19. What does the medical term nephritis mean? A. Inflammation of the liver. B. Inflammation of the kidney. C. Inflammation of the nerve. D. Inflammation of the joint. Answer B. Inflammation of the kidney. This question tests your ability to break down and understand medical terms using common root words and suffixes. The root word nephr/o specifically refers to the kidney, and the suffix itis indicates inflammation. Combining these, nephritis means inflammation of the kidney. Understanding these components is a powerful tool for deciphering medical language. For example, knowing nephr/o helps you recognize that a nephrectomy is the surgical removal of a kidney. Learning these basic root words and suffixes will greatly enhance your ability to understand medical documentation. Question 20. When an operative report describes a surgical procedure for which no specific CPT code exists, what type of code should be used? A. HCPCS Level II code. B. ICD-10 PCS code. C. Unlisted procedure code. D. Modifier -22. Answer, C. Unlisted procedure code. This question addresses the scenario of coding a unique or novel surgical procedure not yet captured by a specific CPT code. When a service is performed and there isn't an exact CPT code to describe it, an unlisted procedure code from the relevant section of the CPT manual is used. These codes end in 99, e.g., 29999 for unlisted arthroscopy procedure. It's crucial to submit an operative report with unlisted codes to explain the procedure and allow for appropriate reimbursement. Remember, using an unlisted code requires thorough documentation to justify its medical necessity and the physician's work involved. Question 21. A patient presents to the emergency department after being struck by a car while crossing the street. Which ICD-10 CM chapter would you find codes to describe the external cause of this injury? A. Chapter 19. Injury, poisoning and certain other consequences of external causes. B. Chapter 20. External causes of morbidity. C. Chapter 13. Diseases of the musculoskeletal system and connective tissue. D. Chapter 21. Factors influencing health status and contact with health services. Answer, B. Chapter 20. External causes of morbidity. This question clarifies the specific chapter in ICD-10 CM used for external cause codes, which describe how an injury occurred. Chapter 20, External Causes of Morbidity, is dedicated to these codes, providing details about the circumstances that led to the injury or health condition. While Chapter 19 codes the injury itself, Chapter 20 codes the event that caused it. For example, V03-11XA, pedestrian on foot injured in collision with car, pickup truck or van, initial encounter, would come from Chapter 20 to describe how the patient was hit. Always remember to also code the actual injuries from Chapter 19 when using external cause codes. Question 22. A claim that has no missing information and passes all electronic edits is often referred to as what? A. Adjudicated claim. B. Denied claim. C. Clean claim. D. Suspended claim. Answer, C. Clean claim. This question focuses on a key concept in medical billing, the clean claim. A clean claim is a claim submitted to a payer that is free of errors, omissions, and inconsistencies, allowing for timely processing and payment. The keywords "no missing information" and "passes all electronic edits" are strong indicators of a clean claim. Submitting clean claims is crucial for efficient revenue cycle management, as they reduce the likelihood of denials and delays in reimbursement. For example, a claim with correct patient demographics, accurate CPT and ICD-10 CM codes, and proper modifiers is considered clean. Aim to submit clean claims every time to minimize rejections and ensure prompt payment. Question 23. A patient has a benign neoplasm, tumor, of the skin of the left arm. In the ICD-10 CM alphabetic index, where would you primarily look up the code for this condition? A. The table of drugs and chemicals. B. The Neoplasm table. C. The external cause of injuries index. D. The main index under skin. Answer B. The Neoplasm table. This question tests your ability to navigate specialized tables within the ICD-10-CM alphabetic index, specifically the Neoplasm table. For any documented neoplasm, whether benign, malignant, or of uncertain behavior, the initial lookup should always be in the Neoplasm table. This table organizes codes by anatomical site and then by the behavior of the neoplasm. For instance, you would look up skin in the Neoplasm table, then navigate to the column for benign to find the correct code. Always remember to use the Neoplasm table first when coding any type of tumor. Question 24. What type of HCPCS Level II codes are used to identify drugs administered intravenously or by injection? A. G codes. B. J codes. C. K codes. D. L codes. Answer B. J codes. This question specifically asks about HCPCS Level II J codes, which are dedicated to reporting drugs administered parenterally, by injection or infusion. J codes are crucial for billing medications that are not typically self-administered by the patient, particularly in an outpatient setting. For example, an injection of a chemotherapy drug or a vitamin B12 shot would typically be billed using a J code. Remember that J codes specify the drug name and dosage, so always ensure your documentation supports the specific J code billed. Question 25. A patient's medical record states a partial thickness burn of the right shoulder, initial encounter. What is the main anatomical root word in shoulder? A. Brachy/O. B. Scapul/O. C. Carpal/O. D. Cos/O. Answer B. Scapul/O. This question tests your knowledge of anatomical root words, specifically for body parts. The root word scapul/O directly refers to the shoulder blade, scapula, which is a key bone in the shoulder region. While other options relate to other arm/chest areas, scapul/O is the most direct anatomical root for shoulder. For example, a scapulectomy is the surgical removal of the shoulder blade. Understanding these root words helps you comprehend anatomical locations in medical documentation, which is essential for accurate coding.